All right, here we are. Hey, listen, welcome everybody. Hi, my name is Byron Elton. I'm the Chief Executive Officer of CancerVax and a cancer survivor. Um, Thanks for joining us tonight, whether you've been following CancerVax from the beginning or you're just joining us now. We're going to give people a few minutes to trickle in, but just want to take a minute to welcome you all, particularly the new people popping into the live stream. We do these on a weekly basis. And it's a good thing because every week brings new evidence that we're on to something really exciting. And really excited to share some recent developments for you. We'll have some existing investors on the call today, and those who are considering making CancerVax part of their portfolio or maybe enhancing your position. But let me just say at the outside, if you're new about hearing about CancerVax, we are working on something truly transformational. It is a universal cancer treatment platform designed to help the immune system finally recognize and eliminate cancer cells while protecting healthy tissue. Now, that's really important to make that distinction. As you know, traditional therapies, and we've had them for many, many years, have been surgery, chemotherapy, radiation, and they haven't had the ability to be precise in terms of killing just cancer cells. We all know somebody who's undergone radiation or chemotherapy and how devastating those treatments can be. 10 million people die every year because the immune system doesn't recognize cancer cells. It recognizes measles. You get them when you're a kid, kills them, it remembers them. If it ever comes back, it says, I know what you are, and it goes in and kills it. So our approach, very simply, is that we trick the immune system into seeing cancer cells as something like measles, and they go in and kill it. So more about that later. We've had an incredibly productive couple of months. And recently we shared some new scientific data that move us even one step closer to that vision. Two things I would mention at the outset. CancerVax.com, that's our website. If you've not been there and it's updated regularly, please go and visit us. There's an explainer video on there, 2.5 minutes, that talks about in very simple terms, our technology. It's fiendishly complicated technology, but it's a simple premise. Secondly, all of our recent milestones that we've hit, and really impressively, the people who are joining CancerVax as scientists and advisors as we get more and more well-known, people top-notch in their field who are hearing about this, and by the way, get hit on all the time to join various companies and are coming to CancerVax and wanting to be a part of this. So we're excited. So welcome to everybody who's joining. I'm going to go old school here. If you'd like to have a conversation with a live person, go to callcancervax.com, calendar app in there, and you can schedule a call with one of our executives. So let's talk about the most recent breakthrough. We'll jump right into that. We announced a major advancement, and that is that our smart mRNA technology successfully avoided healthy human liver cells in vitro. Now, what's in vitro? Some of you know this, but it just means in a dish, in a petri dish. And that sounds kind of simple, but it's one of the hardest problems in cancer therapy. As we talked about before, so many treatments, the traditional ones, even highly effective ones, unintentionally damage healthy liver cells because the liver is involved in metabolic processing. So avoiding off-target toxicity is really, really difficult. But in our latest testing, our smart mRNA remained inactive when exposed to normal human-derived liver cells. That's a big deal. And I'm going to tell you 3 reasons why that's a big deal and what it tells us. One, that our targeting design is working as we have designed it. Secondly, that our activation step is doing its job. And thirdly, that the therapy stays dormant unless it encounters real cancer markers that, again, the immune system thinks are something else, measles, but it's cancer. So anybody that's joining us again on this, thanks for being here. We're discussing some recent developments. Most importantly, that our smart mRNA avoided healthy liver cells in controlled studies. It's one of the clearest demonstrations yet of the precision that we're building into the platform. So again, traditional cancer therapies often spill over, cause damage to healthy tissue. CancerVax is designing a system that turns on only inside cancer cells, leaving healthy cells alone. And our most recent data supports exactly that. It's another stepping stone proving that our universal cancer treatment platform isn't just powerful, it's intelligent. Okay, if you're joining us for the first time, I would encourage you to go to cancervax.com. If you'd like to talk to a real human being, go to callcancervax.com and get on the calendar and let's get a conversation going. Okay, how does this recent announcement fit into the bigger picture? So the new milestone didn't just appear out of thin air. It's part of a sequence of breakthroughs that we've announced recently. Now, I want to just walk you through again. Some of this is repetitive, but it's really important to understand how our technology is designed and how it works. So first of all is the delivery, and we've got some success in there. Our nanoparticle system demonstrated that it could accurately locate and attach to cancer cells while leaving non-cancerous cells alone. So this proves we can deliver the therapy precisely where it needs to go and attach this protein to trick our immune system. Okay, secondly, the disguise breakthrough. Next, we showed that we could make cancer cells look like they're infected with a known pathogen, measles. The immune system instantly recognized the signal and it attacked. That was a major milestone. Tells us that the immune system is capable of launching a strong response once it sees the right flag, the right marked cancer cell. The application to liver cancers, this is important, including cholangiocarcinoma. We confirmed that our platform can be adapted to target different cancer types, including aggressive, really super aggressive cancers, liver cancers like intrahepatic cholangiocarcinoma. And that's the flexibility that we've been aiming for from day one. And now, precision, safety, validation. Our recent announcement ties the entire strategy together. We can find the cancer cells, we can deliver the therapy, and we can activate only the inside malignant cells. And now we've shown that we can avoid healthy liver cells in the process. Now that we've shown that we can do this in vitro, again in a dish, that's a major step toward proving the platform can potentially treat many different kinds of cancer safely, efficiently, and intelligently. And the next step, which we've already begun, it's happening as we speak, is doing it in mice, a requirement that is necessary before we start human clinical trials. So look, what does this mean for the people who are watching? What does it mean for investors? Let's talk about that for a minute. Every scientific milestone we hit reduces risk. Every validation tells us that our universal cancer treatment platform is working the way that we designed it to work. We're building a system at the intersection of AI-guided drug design, nanoparticle delivery systems, smart mRNA activation logic, and immunotherapy targeting principles. These aren't just cutting-edge fields. They're among the fastest advancing sectors in all of biotech, and you can be a part of it. Again, if you'd like to have a conversation with a real-life human being, call cancervax.com, get on our calendar, and let's have that conversation. And also, thanks to Regulation CF, anybody, not just institutional investors, can participate in our growth on Start Engine. Go to startengine.com/CancerVax. Now, we're moving steadily toward the animal studies and clearly early phases of FDA pathway. Every success strengthens the proposition of what we're building. So if you're considering joining us as an investor or you're a current investor and you're looking to increase your position, this is a really powerful time to do so. So I want to thank all of you for joining us today. Our supporters, our scientists, our advisors, everyone tuning in, whether you've been here from the start or you just found us today. We're building something very ambitious. Well, what are we building? We're building a future where the immune system can recognize cancer as easily as it recognizes a known virus like measles and destroy it with precision. These recent milestones that we've been sharing with you today prove that this future is absolutely positive. So again, possible. So if you're interested in doing this, visit us at startengine.com/CancerVax. Visit us at CancerVax.com. Schedule an appointment. Happy to have a conversation with you. Follow our campaign, share our story, and thank you very, very much for joining us today. We really appreciate it, and we'll be back with more updates every single week. Thanks so much.